Good afternoon, and thank you all for coming today. I wanted to inform you about a deadly outbreak going on, Ebola. As some of you may or may not have known, the first U.S. case has just been diagnosed. The 2014 Ebola outbreak is the largest Ebola outbreak in history in West Africa. There have been more than 4,400 confirmed human cases and more than 2,500 known deaths since the history of Ebola. Ebola, previously known as the Ebola hemorrhagic fever, is a severe and often fatal illness in humans that is highly infectious. Ebola first appeared in 1976 with two occurring cases at the same time. One case was in Sudan and the other is in what is known as the Democratic Republic of Congo. The disease occurred in a village near the Ebola River, which is how the disease attained its name. Since then, outbreaks have appeared sporadically in Africa. The natural host of Ebola has not been defined as of yet. Ebola was introduced into the human population through close contact with blood secretions and other body fluids. However, based on evidence and the nature of similar viruses, researchers have believed that bats are to be the host of the virus. Only mammals, specifically humans, bats, monkeys, and apes, have shown the ability to become infected with the virus and spread it. Ebola is not an airborne pathogen, nor is it spread by water or generally by food. People remain infected as long as their body or bodily fluids can contain the virus. From the time of infection, 2 to 21 days can pass before the onset of symptoms. However, the average, according to the CDC, is 8 to 10 days. First symptoms are the onset of fever, fatigue, muscle pain, headaches, or sore throat. This is followed by vomiting, diarrhea, rash, symptoms of impaired kidney and liver function, and in some cases, both internal and external bleeding. Now that we have the background and facts of the virus, I would like to discuss more about the first U.S. patient. The patient, who is identified as a male by the name of Thomas Eric Duncan, was flown into the United States from Liberia, visiting family. This individual is hospitalized in Texas. Since the patient did not show symptoms of the virus until 4 days after arriving to the United States, he was not contagious on the plane or at the airport. Therefore, theoretically, a person infected with Ebola but not experiencing symptoms could fly outside the region without infecting others. Diagnosing Ebola in a person who has been infected for only a few days is difficult. One early symptom, such as fever, is nonspecific to Ebola infection and is seen in patients with more commonly occurring diseases. However, if a person has early symptoms of Ebola and has contact with blood or bodily fluids of a sick person with Ebola or contact with infected animals, they should be isolated and public health care officials should be notified. Samples from this patient can be collected and tested to confirm the identification. These samples are an extreme biohazard risk and will be conducted under maximum biological containment conditions. At this time, no approved vaccine or medication is available to treat or cure Ebola, although 2 potential vaccines are undergoing human safety testing according to the World Health Organization. Typically, symptoms are treated as they appear, providing IV fluids, maintaining oxygen and blood pressure, and treating other infections as they occur is the main focus of treatment. Duncan, the United States Ebola patient, conditions have worsened and no experimental drugs are being given to treat him at this time. The former Ebola patient, Dr. Rick Sakura, who contracted Ebola while working with a relief organization in Liberia, was previously treated. Sakura was given 2 transfusions of blood serum from another Ebola survivor, Dr. Camp Bradley, as well as an experimental drug during his treatment for Ebola. He has been declared virus-free and discharged from the hospital. The Ebola virus has killed more than 3,400 people in African countries. Recovery from Ebola depends on early detection, a good supportive care, and patients on immune system. People who recover from Ebola infection develop antibodies that last for at least 10 years, possibly longer. It is known if people who recover are immune for life or if they can become infected with a different species of Ebola. Some people who have recovered from Ebola have developed long-term complications such as joint and vision problems. In conclusion, due to facts there are no approved vaccines according to Ebola, community engagement is key to successful controlling outbreaks. Raising awareness and factors for Ebola infection and protective measures is an effective way to reduce human transmission. The 3 main ways to avoid the Ebola infection is by understanding the disease, avoiding areas where the virus is common, and avoiding direct contact with infectious individuals.